Mencken.
Thank you, Mr. President. I am proud to be on the floor today, proud to stand with my colleagues, and I hope that I will be proud at the end of this week of all of my colleagues when we vote to defeat this measure, or at least delay it, because we owe the American people the right to be heard. Our responsibility as elected representatives is, at the very least, to listen. And I have been listening over the last week, but really over the last year, to constituents of mine in the state of Connecticut over the last week in 2 hearings, emergency field hearings that I conducted, because no hearings were held by the United States Senate, and no markups and no votes in committee. What we saw here was complete secrecy, a bill produced behind closed doors, and seeing the light of day for the first time last Thursday. My Republican colleagues have gone from total secrecy to total chaos. The reason for the chaos is the facts. Most dramatically revealed today, just hours ago, when the Congressional Budget Office told us, not surprisingly, that 22 million Americans would be thrown to the wolves as a result of this measure, thrown to the wolves of no health care coverage, and 49 million Americans eventually would be without health care insurance by 2026. Next year alone, 15 million more people will be uninsured under the Republican plan, Trumpcare 2. Low-income Americans would be unable to afford any plan at all, and anybody who does would be paying higher costs for fewer services of lesser quality. Americans will pay a higher share of their income and receive less as a result. A 64-year-old making almost $57,000 will go from paying $6,800 under the Affordable Care Act to $20,500 under the proposal before this body. This jump in cost is absolutely staggering, and it will destroy the financial well-being of middle-class Americans, who also, when they need nursing home care, after they have exhausted their savings, will be thrown to the wolves. And I visited one such facility just last Friday, where 2/3 of its 60 beds will be unaffordable when those middle-class families find their savings no longer covered. These facts are the reason for the Republican chaos. One of our former colleagues, my mentor, Senator Daniel Patrick Moynihan, famously said, "Everybody's entitled to his own opinion, but not to his own facts." And the administration's statement that the CBO is not to be blindly trusted, nobody has to trust the CBO blindly. Those facts are driven by reality. Their report speaks truth to power and to the American people, and the American people get it. None of us can look our constituents in the eye, look ourselves in the mirror, look inside ourselves at our hearts, and justify a vote for this bill. The American people are angry, many of them, because we are even considering it. And it's not an anger that is kind of a shrug of the shoulders. It's a deep, vocal, vehement, vitriolic anger. And I have seen it and heard it at those hearings where I listen to people coming forward and talking about this bill, recognizing it for what it is, not a health care bill, a massive tax cut for the wealthy. Just Friday afternoon, one of the folks who attended the hearing came to the microphone and said, "Don't call it a health care bill, it's a wealth care bill." And in fact, she is absolutely right. This bill cuts millions, hundreds of millions of dollars in taxes for the richest so that they will do better, but it also cuts $800 billion in Medicaid spending and investment to provide for that kind of tax cut. It is not a health care bill, it is a wealth care bill. And for most Americans, it is a catastrophic, cruel, and costly insult to their intelligence, their health, and our American values. It is a sham and a charade, making possible those cuts for the rich, tax cuts for them at the expense of our most vulnerable citizens. And it has been the result of a profoundly undemocratic process, secrecy and speed. Despite the best efforts of our Republican colleagues to keep Americans in the dark about what this proposal would do, I've seen growing awareness. Again, not only at these hearings, but as I walk through the airport, as I march in parades twice over this weekend, as I attend public gatherings, whether it is Boys State, sponsored by the American Legion for 16 and 17-year-olds, or nursing facilities for elderly citizens, a growing awareness that this bill is bad, profoundly bad for the American people. The people I've heard from have prescriptions to fill, appointments to make, lives to live, but they have come to these hearings on very short notice in Hartford and New Haven, literally filling rooms so that there was standing room only. And I challenge my colleagues to hold the same kind of hearing, to delay this vote so they can go home at the end of this week and hold hearings in their states. Listen to their constituents about what they have to say and what the consequences will be. Nearly 1 in 10 veterans have Medicaid coverage, meaning that a staggering 1.75 million veterans, including 18,000 veterans in Connecticut, would be impacted by these reckless cuts. Let me repeat that number for all of us who rejoiced in the recent Accountability and Whistleblowers Act. 1.75 million veterans and 18,000 of them in Connecticut would be harmed by this reckless and needless insult and injury. Put simply, this bill would make it harder for veterans with mental health disorders like post-traumatic stress to get care. Nearly a quarter of all veterans receive care for their mental health disorders outside of the VA system, meaning they rely on protections that guarantee their access to affordable care. Under this proposal, those protections would be severely threatened, and the veterans who need that care would see that care at risk. Here we are talking about a choice program that enables veterans to seek care outside the VA system privately, and we are endangering care for millions of Americans, veterans who need and seek it by using Medicaid. If my colleagues listened to their constituents, they would hear from many of the people who have come to my town halls, like Christine Gerasi. Christina has two beautiful 4-year-old twins named Mackenzie and Cameron. Mackenzie was born with Prader-Willi syndrome, a rare genetic disorder that her mom described as, quote, including low muscle tone, seizures, temperature instability, sleep apnea, infertility, OCD, intellectual disabilities, and developmental delay, end quote. In the first few weeks of her life, Mackenzie was in the hospital for 57 days, accounting for $2 million in costs. Their family was spending $30,000 a year to help their daughter thrive. So when Christine learned that her daughter had received a waiver to become a Medicaid beneficiary, she was overjoyed. Christine told me, quote, when we received Mackenzie's diagnosis, we were told that she wouldn't do a lot of things, and at only 4 years old, she's already defying the odds. I have no doubt in my mind that if we are able to continue down our current path of the proper therapies and doctors, Mackenzie will be able to have her fruitful life. I am terrified if the rug comes out beneath her that she will become just another statistic. Another statistic? There are enough statistics in that CBO report. We will hear a plethora of statistics on the floor, but a picture is worth 1,000 words and many more than 1,000 statistics, and no one should be consigned to be a statistic. This family is one of the many faces and pictures and stories of Medicaid. They deserve to be heard. If we gut this program, if we strip away the important services it provides, we know all too well what will happen to Mackenzie and her family as statistics. Like her mother said, Medicaid has been the path for them to success. And that rug will be pulled from that family beneath Mackenzie. At the hearing on Friday in New Haven, I heard from Ken O'Brien, who told me about the 8 prescription medications he takes, 4 for psychiatric reasons and 4 for medical ones. Now, of course, mental health parity has been one of the crusades of my life. When I was State Attorney General, I worked with Senator Ted Kennedy and Congressman Patrick Kennedy to help advocate for that bill. As a senator, I advocated the regulations that were necessary for its enforcement, and we finally got it done. I want to quote what Ken said directly. He told me, quote, "And if I lose my Medicare and Medicaid, I will be unable to pay for them, obviously, which in turn, I will end up in the hospital," end quote. Kent went on, let me quote him, "Now, for the Republicans who are seeing in this Washington, can you please listen to me carefully? I am speaking to an empty chamber. Let nobody make any mistake that Republicans are hanging on Kent's word as I speak now. But every one of them should go to the record. Every one of them should be listening in their offices. Every one of them should go to the record. And I will place Kent's testimony in the record along with all of the testimony that we heard last Friday, as I did the testimony from Monday's emergency health care hearing, if there is no objection. Thank you, Mr. President. So, Washington, please listen to me carefully. If I lose that medication, I will end up in the hospital. and it's going to cost the state and the federal government much more money than it would be to simply let me and pick up my medication. If there were ever a message that Washington should hear, it is from Kent O'Brien, who closed by saying simply, quote, "Don't hurt the American people," end quote. Now, if you met Kent, you would wonder how he was capable of that eloquence. He's an ordinary American, someone who looks like all the rest of us, but he has said to this body what it needs to hear. Don't hurt the American people. And he couldn't be more right. This proposal will cost our nation so much, not just financially, Kent had it right, but morally. It will lead to a weakening of what makes our country strong and great in the first place. Our ability to care about our neighbor, to fight for what is right, and to listen to the people we represent here in the United States Senate. First, do no harm. That's what the ethos of the medical profession is, and it ought to be our mantra as well, and it ought to be what my colleagues, if nothing else, heed as we reach this decision. To listen to people who sent you here and hear their stories. Listen to the anxieties and fears and values of America. They will tell you all you need to know about this bill. Kent told me, as he said, the costs will be staggering. Not just in financial terms, but human terms. This bill, written behind closed doors, away from the light of day, away from the realities of medical care in the United States of America, away from the voices and faces that I have brought to the floor today, and I will continue to bring them to the floor, ignore the most important thing we can do this week. As Kent said, don't hurt the American people. As the doctors tell us, first, do no harm. Thank you, Mr. President. I yield the floor.